You're listening to Power Talk, Berkeley Electric Cooperative's official broadcast about the cooperative, our communities, and ways to use energy wisely. And now, let's join our hosts for today's episode. Hello, and welcome to another edition of Power Talk. I am Micah Ponce, one of your hosts today. I am the Communications and Media Specialist here at Berkeley Electric Cooperative, and I am joined by Miss Libby Roig, the Director of Marketing and Communications. Hello, Libby.
Good morning, Micah.
Well, we got another exciting day here on Power Talk. We've got a special guest in from the community, Miss Tamika Obeng, the Outreach Coordinator for St. James Health and Wellness. Welcome.
Thank you.
Well, welcome to the show. You know, we're glad to be partnering with St. James. I believe we've got an upcoming health clinic that we're going to be doing with y'all. What date was that?
It's April.
April 13th.
Mm-hmm.
Yep, there it is. Yep, and it was going to be at our Awendaw office.
Mm-hmm. Yep.
Down there. Beautiful coast. Come on out.
Yeah.
But before we get too far into it, let's reel it back in a little bit. And you're new to the show. We always like to hear about our guests. So why don't you tell us a little bit about yourself, your background, and how you ended up with St. James?
Sure. Well, thank you for inviting me. I'm really happy to be here. I'm a native of South Carolina. I moved away a couple of years ago, came back. I've been back in the Carolinas for about 5 years now.
Mm-hmm.
Always had a heart for service and landed a great job. My dream job with St. James is the outreach worker. And from the outreach worker went into being the outreach coordinator. And so I have a heart of passion to serve the rural communities. And that's what I've been doing for the past about 3.5 years now.
Okay.
So I really enjoy it.
Well, one of our last shows that we had our Director of Vegetation Operations on, and a little bit of a segue, but you mentioned that you were a native, and there was a whole discussion about native and non-native trees. And
Yeah.
So you're a native, so he'd like you.
Yeah. I'm a native of Georgetown, to be specific, Georgetown, South Carolina, but just rural healthcare is my passion.
Yeah.
I'm not a native. I'm originally from Florida, but I've been here for a good while. I've been here for a long time.
I grew up here, so I'm naturalized.
That's right. Get a pass.
Well, St. James has been providing health care for more than 40 years, I believe. And like you said, Georgetown, where you're located, that's where y'all are working out of. But you're serving well beyond just the Georgetown area. Is that correct?
Exactly.
So where all do you serve?
Well, we have 7 sites, primarily all of Georgetown County, parts of Berkeley and Charleston. And so we have our main site, which is in McClellanville, but that Berkeley area we serve Schuylerville, Jamestown, and the Hugie communities.
Okay. Yep, I'm familiar with Schuylerville. We go out that way every once in a while. That's out in the forest. Out in the national forest. But all part of our service territory, all the way McClellanville. We all of our members equally. We love them all. Well, what's this? That's where you are. So what is the mission of St. James? What is, for those folks who are listening who might not be familiar with you, what is the mission of?
Okay. Well, that's really simple. St. James Health and Wellness, our mission is to provide quality health care service, primary health care services respectfully, compassionately to one patient at a time. And we've been doing that for about 43 years. So we're excited to continue doing that in those communities that were mentioned earlier. And we're expanding even beyond that with our mobile unit that we'll get into a little bit later. But we have so many great initiatives that we take pride in, especially for those communities.
What services do you guys provide?
Sure. So I look at it from the top on down. So from mental health, we have a mental health professional. We also have an optometrist that visits our site. We have a partnership that provides dental services for our patients. That's with a nonprofit by the name of Helping Hands. Going into our internal medicine. And then we go into our pediatrics department. And so we're a full-fledged medical center. You know, it's all about preventative health care, from treatment to diagnosis. We do it. We cover it.
And is there cost associated with it, or how does that work?
That's a great question, because St. James is a federally qualified healthcare center. And for folks who don't know what that is, that means that we are mandated by the government to provide care and to show that we're closing those gaps in healthcare. And so we treat individuals on a sliding scale, and that's regardless if they have an ability to pay or not. So you can come into our site, and if you have insurance, if you don't have insurance, we will still see you, and you're treated on a sliding scale basis. So we don't turn anyone away. That's what we're here to do.
And, Tamika, you mentioned the importance of preventative care. Here at Berkeley Electric, I was just having a conversation with some of the management, and they mentioned we have an incentive in our healthcare package this year to go get a physical.
Yes.
And, I was asking about that, and he said, only 11% of BEC employees had been to the doctor. And, you may feel fine. You may be used to how you feel. But if you're not seeing a doctor regularly, you can't nip some of those conditions in the bud and, keep them from escalating, identifying cancer early, treating that.
Exactly. And so one of our initiatives that's been really successful is our Take a Loved One to the Doctor voucher. And we have that. We started that about a year ago. And so that's a voucher where you can come into any of our sites, any 7 of them, and actually present this coupon and get a full physical absolutely free.
Wow.
That's including blood work. If you have not been to our sites within 2023, now we're in 2024, you can come in and say, hey, I have a voucher. I'd like to be seen. And so you'll be seen for a physical. And so that's something that we're really wanting the community to know about, because we want to remove those barriers.
Yeah.
So financial barriers, even if it's transportation. So we're able to assist in those areas as well. So it's important. We want you to come in to your doctor on a regular basis, but some folks feel like, nothing is wrong. But we have to kind of change that mindset.
Yeah.
And get in to see your doctor. Hey, we have vouchers out here, absolutely free. So come by and visit us.
I'll have to confess, I'm one of those people.
Yes.
I haven't been to the doctor so long, they dropped me as a patient.
Oh, wow.
my God.
So I am no longer in the system because it's been that long since I've actually been to the doctor. So
You're not alone. You're not alone.
And actually, just talking about the importance of doctors, and you had mentioned eye care. I just recently went through a whole little thing trying to just get my prescription right, and it makes a difference.
It does.
It makes a difference.
Really does.
The world's much clearer now that I've gone to the doctor and gotten an adjustment.
Well, I'm a mom, and my husband and I have a little 8-year-old boy. And, when you've got a baby, you're getting all those monthly checkups and then annual checkups. And we do such a good job taking care of our kids. But when you reach an age, you just you're comfortable with how you feel. You may not think there's anything that could be better. Yeah. But
so it's prioritizing, and so also providing St. James, we provide health education, just what you're talking about. So when we're going out into the communities, because if you can't get to us, we can get to you.
Yeah.
And so that's what makes us really unique in those communities, having an outreach department, having an opportunity to engage with you, having conversation like this to get the word out. So that's pretty unique in itself.
Yeah.
For St. James, we're not your traditional doctor's office. We go beyond that traditional doctor-patient relationship.
And you had mentioned the outreach and everything, and that was one of the things that I was just thinking about. And you were talking also about the sliding scale for folks in terms of what they can pay and what they can afford. A lot of times, income level does have a big impact on your health, whether or not you have the means to travel to the doctor. We all talk about healthcare these days. Even if you have insurance, it can be daunting sometimes.
Definitely.
To even consider going to the doctor and paying a copay, or what does the insurance not cover?
Absolutely.
And so it's gotten very complicated. And so I think a lot of people just get sort of scared or put off and confused. It's too much.
Yeah.
I feel good. Nothing's wrong right now. I just don't want to deal with it. So, I can understand where the impetus for a lot of these people that might keep them away from the doctor. So no excuses.
Yeah.
If you're listening, there's no excuses. They will come
We're
to
here
you.
to help.
That's
Exactly.
right. That's right.
But, Tamika, another way you guys are a little bit different is your food pantry, or as you say, food pharmacy. Tell us.
Pharmacy.
Yeah.
It's exciting. It's exciting because we are making a difference, and I see that literally on a daily basis. So with our food pharmacy, that was started about a year ago. I think we're coming up on the year anniversary, and it's at our main site, which is in McClellanville. But again, that food pantry services that Schuylerville area, the Jamestown and Hugie area. And so if you're a patient of ours, you can come into our facility and have a whole shopping experience. And that way there is a dignity to what we do. So at the food pharmacy, you're going to come in, you'll be able to have fresh produce. From a nutritional standpoint, it's not just your perishable items or non-perishable. So we give you a variety. You may come in one week and there'll be fresh strawberries, or it may be some blackberries or squash or zucchini. So there's a variety of produce within the food pharmacy to our patients' benefit. And with that, we also provide education as far as recipes. Where we are culturally, some folks may not be aware of what to do with brown rice or how should it be prepared. So we're not only giving you a shopping experience, but we're providing conversation and encouraging you to come in and shop and try new recipes and give you suggestions. So we're excited that that's going very well and really proud of it.
And Tamika, talk about the location of that food pharmacy. You know,
Sure.
what all's around there, and why is it important to have that?
It's basically a food desert. So there are not grocery stores within that area. And so a lot of times with our patients, they're coming to the doctor's office, but that may be their only outing, you know, for that week. And so when you're coming to the doctor's office, you have the opportunity to, you know, look and see if you need any onions or sweet potatoes or what have you. We provide that as from a holistic standpoint. So we're not just the health part, but the wellness aspect comes into play a lot in that nature, because we really are in a food desert in that community, or in those communities primarily. So we're pretty much like a lifeline to a lot of individuals. And they look forward to it. They're greatly appreciated. So that's why we do what we do, and we have wonderful partnerships to help us sustain that food pharmacy as well.
And you mentioned the fresh produce, but do you do like milk and eggs and meat as well?
Absolutely. Milk, eggs. Right now we have chicken. There's ground beef. So there is whole milk. There's zucchini, onions, squash. I mean, you get a whole shopping experience. There's hummus. So, you know, something that traditionally may not be used by patients, but if we introduce it, that's the whole concept behind it. So healthy options. You want to provide options for the individuals there, not just to say, hey, we only have this today. We have a variety of different items that you can actually take home, try out, and hopefully you'll return and say, that was really good. I had no idea.
That's awesome.
Way too early in the morning to talking to all this food. I skip breakfast. Y'all are making me hungry. No, one of the things that I love is we've worked with a couple of food pantries before, and the introduction of the recipe cards. I mean, to me, that's a game changer, because a lot of times, you know, you give me kale or something like that. I might not, that's something that I don't use on a regular basis. I don't know what I can do with it.
Exactly.
So, I mean, having those handy recipes, I would probably mess it up somehow too anyway. But I mean, you know, at least, like I said, you've got a better chance of cooking it and having it be tasty and being exposed to something, like you said, that you may not use on a regular basis. And a lot of times when you go to the grocery stores, it might be cheaper and you might skip over it though, because
you just don't know.
Don't know. What do I do with a dragon fruit?
Exactly. So we have volunteers that help to manage our food pharmacy, and so they're there to provide conversation, encouragement. And so when you're walking in, you're just not kind of walking in blindly, to provide the shopping bags and to say, hey, well, we have this today or what have you. So it really is an experience. And I like to say that we're teaching folks how to eat to live and not live to eat. So the mentality kind of shifts at some point, that this is a fresh produce and maybe I should try some wheat or some brown rice today.
Yeah, it might be their new favorite food. You never know.
Exactly.
Brown rice is not my favorite food.
Well, it tastes about the same.
It's not bad. It just takes some getting used to. I mean, like you said, if it's not something that you're used to on a regular basis, but I mean, and the whole point, like you said, it's a pharmacy and it's a healthy thing, because today we eat so much processed food.
Yes.
I'm 100% guilty of that. And so if you have something that you can snack on, or, you know, a healthy meal, it's important. I mean, it's hard to overstate the importance of having a few solid meals meals throughout the day.
Yeah.
I mean, it affects your energy, it affects your mental state. And so, yeah, I mean, that type of thing is incredibly important to have for the health and well-being of all of our members. And one of the things that we talk about, here at the co-op is we serve a wide variety. We serve a very large area from, all the way up in Pineville and Cross to McClellanville. And one of the unique characteristics, I guess, about, like you said, when you get out into the rural areas is it's a food desert. And also, we've talked to some other folks before and partner with transportation's an issue. And so not having the ability to just jump in your car and drive down to the nearest grocery store, which may be quite a distance away. So accessibility is also one of those key things. So accessibility to healthy food. Education, recipe cards. I'm here all for it. I'm here for
Way
it.
to go.
So it's holistically. So accessibility to primary health care. That is what we do at St. James, providing accessible health care to all individuals. And so we take pride in that.
And just for the folks listening who may not have been there before, what are your hours of operation? Are y'all 7 days a week?
We're not 7 days a week.
In
a perfect world, that would be nice. So I'm going to speak primarily to our McClellanville site. And so that would be Monday, Tuesdays, and Wednesdays. And so that would be just regular typical hours. Right now, I believe from 8 to, I think our late days are on Wednesdays, and we close at 6:30. So we do have one late day in the week where it's we're closing at 6:30. And I believe on Fridays we do not operate for patients. And I believe Thursday the food pantry is also closed, but we're accepting patients. So, so our hours right now, we're tweaking them a little bit, but we're here to serve.
You talked about the fact that, each area is unique, and you've got 7 clinics across the Low Country, Choppy, Sandpit, Andrews. Do you see distinctions between each of those districts and the populations? Does each one of them have, I guess, their own special sort of challenges?
They do. I will go into the Berkeley area. And so culturally, you want to be sensitive. You want to be mindful of the communities that you're serving. Tight-knit families throughout all of the communities, I would venture to say they're all very tight-knit, culturally sensitive. A lot of times you come in with, let's say, Georgetown, that community's changing. More diversity, Hispanic population. With Sandpit, but with Berkeley, it seems to be traditionally it's generational. And so it's almost like if we have one patient that's coming to us, 9 times out of 10, some other family members are also coming to St. James. So staying in the know of what's going on in the community via the religious leaders, church communities, that's where a lot of information is disseminated upon. And so we just want to build trust with those communities. So primarily it's going into the community, seeing where the need is and actually meeting the need, and having conversations, whether it's small talks or focus forums. That's what we aim to do, to meet the people where they are. That's how I would really put that.
Definitely.
Yeah.
Any plans for expansion to other areas?
We would love to expand to other areas. It is a process. The first step, I think, as far as expanding would be our new mobile unit that just arrived yesterday. So we are right at 24 hours with that.
Wow.
And so details will be forthcoming as to how that will be rolled out into those communities. But it's an exciting time, and we are excited about it and just want to get ready to go on tour and just pretty much be a benefit to those communities that so desperately need us. Some folks can come to us and some can't. But again, preventative health care, quality health care, that's what St. James is all about. And so now that we have this unit to go into these communities, it's pretty much full speed ahead. And we don't know what this year is going to come. We may have another site. Who knows? There definitely is a need for more medical services throughout the Tri-County area.
It's so awe-inspiring. You talk about metaphorically meeting people where they are and trying to answer those needs. But now with this mobile unit, you're literally meeting them where they are.
Yeah. So I think a lot of times we have resources, but for whatever reason, folks aren't sure. Well, what exactly do we do? And so that's why you have me go into those communities. So that's what makes us unique, to actually engage and have conversations and break it down bit by bit, and just to its simplest form, and say, hey, it's all about preventive health care.
Yeah.
It's about making St. James your medical home provider. So that's what we aim to do. And the work does not stop. It's continuous. As our communities grow and as just our communities change, we have to be able to see what's going on, hear what's going on, and continue great partnerships.
Yeah, definitely.
Well, you mentioned, partnerships, and, we're right on board as an electric cooperative. You said go to where the people are and meet them out in the community. I mean, and that's why we like partnering with organizations like y'all, because that's really sort of the heart of the service of an electric cooperative as well. We do our best to go out into the communities.
Absolutely.
And like you mentioned, each community is completely different. I mean, we've got 4 different district offices, and when you've been to one area, you've been to that one area. It's completely different from the other areas that we serve, and we even see it in our linemen. I mean, we've got like distinct personalities for the different groups of linemen and everything. So you have to be aware of where you are and talk to the people in the language that they understand.
That's absolutely correct.
So we applaud you for the business that you've been doing. But one of the things I just heard you say is that trends that you notice, and this is something that I just thought of just a little while ago, but y'all as St. James have been serving the Low Country for over 40 years, and you've been there 10. Well,
not 10,
not 10. You've been there a while.
I've been there for a good little while. And want to continue that.
Right, but I mean, are there any trends that you're seeing in healthcare? I mean, we had. Things changed a lot, when COVID came through, and the realities in a lot of communities have changed. So the way they looked before might not be the way they look now. So are there any trends that you're seeing in healthcare?
I would say mental health. Mental health definitely is at the forefront of conversation. And so we have to be mindful that we serve the rural communities. Yeah. And so that's a whole different ball game when it comes to mental health, because you talk about possibly isolation issues, food insecurity. So we're looking at so many different issues that could occur, in addition to not being able to have access to certain things that you need on a daily basis. So I would say mental health definitely needs to be a conversation that we need to really look at more intimately, and find ways in which we can be able to meet those gaps, especially in the communities that we serve together as partners, and what we can do as far as health education. I think with the food insecurity, we're well on our way to making a really good footprint in that area. So, and again, having engagement sessions with community to really see what's going on and how we can be of better service. So you just don't want to go into a community and leave. Consistency. Right. Consistency and building trust with that community means a lot, because that's when you get to hear things. Oh, yeah. And in the know. And so we try to stay in the know of what's going on in our communities.
And we were talking about the importance of being a native. I mean, you sort of have to be a native to these areas, because like you said, you just can't just fly in and throw out a couple little things here and there, and then they don't hear from you for another year or so, and then you come back. You're not going to build trust that way. No, you're not going to find out what the flavor of that community is, and what the the obstacles, the challenges that they're facing, and the opportunities.
Yep. There's a rhythm to it. Each community has their own rhythm, their own cadence, and so we have to find out what that is, and then act accordingly.
Yeah, definitely.
We're touching on the importance of being a good neighbor and maintaining partnerships, and we're talked a little bit about it at the beginning of the show. We're going to circle back around. Okay. One of the things that we've got coming up is we're going to be doing our healthcare clinic and safety awareness clinic, I believe, is also going to be doing it. It's going to be coming up on Saturday, April 13th, and it's going to be at our Awendaw office.
Yep, right there on Highway 17.
What time are we going to be there? You remember?
10 a.m. to 1 p.m.
Okay.
And we have a variety of vendors. We're so thrilled to have St. James as
we're
one
excited.
of those. But like Micah said, safety is health. And so our Liveline demo trailer, if you haven't ever seen that, it really is some good information. We'll have some linemen on hand to show you different ways to stay safe around electricity and other health-related vendors.
Yeah, we're excited. We're really excited to come out and show the community what we have to offer. So we're looking forward to it.
Well, hopefully it's just the first of many that we'll have out there.
Yeah.
Through the years that you've been involved in healthcare and in this area, are there, we always sort of fall back on sharing stories about things that we've seen. Is there anything in particular that sort of comes to mind that you've encountered through your time there that sort of, one thing that really sort of stood out or like touched you or sort of emphasizes the purpose of what y'all are doing?
For me, I don't think it's just one in particular instance. I think it's just a series of gratitude, just to see the faces of individuals that we serve, and they're so appreciative of what we do. And so I like to think about, if we weren't in the community, would anyone know? Would anyone would anyone notice that we're not there? And I'm safe to say that yes. So we do make a difference every day, and even now more so than ever. And just from our patients and their commitment to give us opportunity to serve them, we're just grateful that they continue to see us for patient services, for medical care services. So that alone, because there are many options where you can go for medical home or for medical treatment, but they choose to stick with St. James. And so we don't disappoint. We do not disappoint. So we're committed to servicing all individuals.
Yeah, and I mean, I don't think I've got any health-related type things, but I mean, just the different areas that we serve. I mean, it's so easy to see the need. Even when we talk about Johns Island, our area, and that area has seen a ton of growth recently. But I mean, no matter where you are, there's always going to be pockets that are, a little bit, I won't say worse
TLC.
off. Yeah, need the TLC.
Yeah.
So I mean, we've partnered with other organizations before doing some home improvements, and I went into this one lady's home, and she's an elderly lady, and honestly, I couldn't even see how she was living there.
Yeah.
I mean, the kitchen was basically not functional. One of the rooms had fallen in.
Yeah.
The ceiling was sagging. And so, I mean, those type of things, it's all you got to do is turn down one road and you're going to find the need.
Definitely.
In all parts of our service territory. So we're always appreciative of having partners like y'all and the job that y'all are doing to help take care of our members as well.
Yeah, and then we have partners. So, so that's what it is. It's pretty much making sure that we are in the know, but also building those relationships with our partners so we can continue to help a wide variety of people. So we may not be able to help with a roof, but we may have connections who may be able to assist with that. So, and that's where the outreach department comes in at. So providing additional resources or communication. So it's about conversation. That's what I feel it's about conversation too.
Definitely. What are some of the partners that you guys work with? Sure.
What comes to mind right now is Trident United Way, which is a wonderful partner who has assisted us greatly with funding throughout the course of this past year or so. So we work well with them, providing networking opportunities, which is a great tool that we use. Also, Low Country Food Bank that has helped to pretty much sustain our food pharmacy and pretty much given us the guiding tools as to how it should be set up and how we should continue to be effective in running it. So those are two great partners, and I cannot forget our religious community because they are very much instrumental in how we communicate with those residents in those communities, such as Jamestown and Hughie and Schulerville. So they help us to stay in the know of what's going on. So, partnership is definitely something that we take seriously and that we like to continue to have even broader partnerships. So if there's anybody out there listening, any other nonprofit agencies, feel free to give us a call or get in contact with St. James, and we'll be able to do even more good work in the community.
Well, you mentioned two of the big sponsors that we work with, too, or partners that we work with, which is the Low Country Food Bank, and then actually Trident United Way is our primary charity that a lot of our employees donate to. And matter of fact, we have drives every year and encourage them because we know the kind of impact that they can have throughout our entire service territory. So we're always looking for those partners who are spreading love and doing the most good to help our members.
Absolutely.
So, well, we have been visiting with Ms. Tamika Obeng from the St. James Wellness and was it Health Clinic? Nope.
Health and wellness.
Health and wellness.
You got it.
I got it.
You
I'll
got
get it. Yeah. But, learning all about their mission here in the Low Country, and we certainly appreciate everything that you've done and taking the time to share with us today and making the trip up here.
Well, thank you again for having me. It's great. It's been a great opportunity, and I'm just excited to continue doing the work along with my wonderful staff and organization. We're making a difference every day.
We like to hear it. Well, folks, that's going to do it for another edition of Power Talk. Thank you for tuning in. This is the official broadcast of your electric cooperative, and you can catch up on past episodes on streaming platforms like Spotify, Apple, and iHeartRadio. And always, you can get a behind-the-scenes look at Berkeley Electric's YouTube channel. Until next time, this is Power Talk, signing off.